It is with a heavy heart that I must announce that the United States is cutting $50 million, that's 1.4 billion kwacha, in annual aid to Zambia provided for medications and medical supplies.
Welcome to Zambia Today Television, where stories unfold. Bringing you breaking news that could have a profound impact on Zambia's healthcare sector and international relations.
Billion kwacha in annual aid to Zambia provided for medications and medical supplies.
In a significant and deeply concerning development, the United States government has announced the suspension of medical aid to Zambia, citing what it calls the countrywide, systematic theft of medications and medical supplies donated by American taxpayers. U.S. Ambassador to Zambia, Michael Gonzalez, made the announcement during a press briefing at the U.S. Embassy in Lusaka. He expressed frustration over the Zambian government's failure to act decisively in the face of rampant theft within the public health system.
For more than 1 year, the government of the United States has requested tangible action from the government of Zambia to respond to the countrywide systematic theft of these products provided by the United States. In the face of minimal action, responsive action by the government of Zambia, the United States is taking necessary steps to safeguard and ensure the accountability of U.S. American taxpayer funds. For more than 60 years, the United States and Zambia have shared a strong friendship. Because of our commitment to Zambia and the Zambian people, in recent years, the United States has invested more than $600 million a year, that's nearly 17 billion kwacha annually, toward our shared goals of economic development and improved health and public well-being. Roughly 1 in every 3 kwacha spent on public health in Zambia comes as grant assistance from the American people. As part of this, in recent years, the United States has provided approximately $128 million annually. That's about 3.5 billion kwacha every year to buy medications to treat HIV, malaria, and tuberculosis, as well as to provide the technical and operational support for Zambia's national health supply chain. These medications and supplies are intended to be provided for free to the Zambian patients in need. Now today, millions of Zambians are living longer, healthier lives because of this assistance, which comes again in the form of grants, not loans, provided by the American taxpayer. We're incredibly proud to have partnered with Zambia to reverse the AIDS epidemic and to reach epidemic control today. Due to joint efforts by the United States and Zambia, 98% of Zambians living with HIV know their status. 99% of Zambians who know they are HIV positive are now on treatment. And 98% of HIV positive Zambians on treatment are virally suppressed, meaning they cannot transmit the virus. Beyond our support related to HIV, over the past 10 years, our joint efforts have helped reduce deaths from malaria and tuberculosis by more than 75%. Our investments in Zambia are intended to benefit the Zambian people. U.S. donated medical supplies and medicines, which include antiretrovirals or ARVs, but also tuberculosis and anti-malarial drugs and others, are made available to Zambians for free. Today, 1 in every 9 Zambians is living with HIV. But the majority of those 1.3 million Zambians is virally suppressed. They can't transmit the virus because of ARVs provided by the United States and intended for free distribution.
4 years, the United States has been a major donor in Zambia's health sector, channeling millions of dollars annually to fight diseases like HIV, AIDS, and malaria. But recent audits and investigations have uncovered widespread theft and diversion of these life-saving supplies.
However, I am disappointed to share publicly today that since 2021, we've uncovered systematic theft of life-saving medicines and other products that were intended for free for the Zambian public, including ARVs and anti-tuberculosis, anti-malaria treatments. Now, as soon as we discovered this countrywide theft in late 2021, we immediately informed the Zambian government of our findings, and we initiated an across the country on-the-ground assessment of private pharmacies to understand the extent of the issue. From 2021 through late 2023, our buyers visited more than 2,000 pharmacies in every province and district of this country that sell the same types of products that the United States provides for free to Zambia's healthcare system. Shockingly, across these visits, 95% of the pharmacies that were selling the kinds of products that the United States provides were also selling stolen goods. Of those pharmacies selling stolen goods, 45% were selling stolen products that the United States had provided to Zambia for free for Zambians in need. Let me repeat that. In all 10 provinces, nearly half of the pharmacies that were selling the types of products that the United States provides for free for the Zambian people were selling stolen medications and medical supplies donated by the United States government. Now, the rest of the pharmacies that were selling stolen products were still selling stolen medicines and supplies from stocks that were purchased by the Zambian government, by the Global Fund, by other donor partners. On April 3rd of last year, 2024, I brought this alarming information to the attention of senior Zambian government leaders. In attendance at the meeting on that day were high-level officials from multiple ministries, from multiple law enforcement agencies and the executive. I asked them to take meaningful action on two fronts. First, I asked for action to mitigate further theft of U.S. provided goods. And second, I asked to enforce high-level accountability for those who are involved in stealing these life-saving medicines from the Zambian people. Over the next 13 months, through more than 33 senior meetings with permanent secretary level or higher Zambian officials by U.S. Embassy staff, senior officials from Washington, and me, we reiterated our requests to the Zambian government for action to stop the further theft and to bring the culprits to justice. We even offered U.S. government experts in supply chain management and in law enforcement to partner with Zambian counterparts to support the requested efforts. I regret that to date, the government's actions have fallen drastically short of demonstrating a commitment to safeguarding U.S. assistance and the lives that we aim to save with it.
Despite multiple warnings and clear evidence presented to Lusaka, the U.S. says there's been no meaningful reform, no decisive action, and no accountability. And now, ordinary Zambians may bear the brunt of that inaction. But the message from Washington is clear: continued support hinges on Zambia's willingness to fight corruption and protect donated resources.
Apply sources or pursuing the masterminds behind the theft of medicines. Law enforcement operations have focused more often than not on low-level actors and have led to the arrest of only a few mid-level officials.
We will continue to follow this developing story closely and bring you updates as they unfold. For now, this is Zambia Today Television, where stories unfold. Don't forget to like, share, and subscribe for more in-depth coverage.
A private report. Since October, I've alerted senior government officials of my obligation to safeguard American taxpayers' resources in the face of the gross theft and mismanagement. I have stressed repeatedly that the accountable safeguarding of American taxpayer funds will require the United States to significantly reduce our contribution of medicines and medical supplies if meaningful action is not taken to hold high-level corporates responsible and to stop that theft.